Good afternoon, everybody. Welcome to Florida Advocates for Behavioral Health's first webinar, Navigating Florida's Behavioral Health System. My name is Amy McClellan, and I'm the president of the board of Florida Advocates for Behavioral Health. I'm going to be your host today, along with Gail Giese, president of the Florida Mental Health Advocacy Coalition, which is a sister organization of ours. And she's also a member of the Florida Advocates for Behavioral Health Board. So if you've never heard of our organization before, let me introduce you. We are a very new nonprofit organization that was founded just this year. And our mission is to educate Floridians on behavioral health issues and policies, to improve the lives of individuals and families living with behavioral health conditions while decreasing stigma through increased understanding. So we created Florida Advocates for Behavioral Health to share Florida-specific information. I'm a parent myself who went through years of trying to figure out what was happening to my 14-year-old daughter, whose behavior suddenly changed in an alarming and frightening way. I was completely unfamiliar with mental health conditions, and I became desperate to find out what was happening to her. And I had no idea where to go for answers or where to get the right help. And she was eventually diagnosed with bipolar disorder. And then after that, we had another difficult journey, just trying to find the right treatment. So the goal of our organization is to make it much easier for peers and family members who live in Florida to find the help they need as soon as possible, hopefully in their own communities. We'll be offering webinars and educational materials to explain how the system works and how to advocate for yourself to get the help you need. At the end of this webinar, we'll show you a resource guide that we've created that will be available to you on our website. That will have a QR code where you can open it up, you can download it, or just look at it on our website. And you can also sign up for future webinars that we'll be sponsoring. And I'd like to thank our three wonderful sponsors, North Star Financial Planners, Cornerstone Solutions, and Newport Healthcare for supporting this first webinar and the topic of behavioral health, which is so important. And if you want to learn more about these companies, we'll feature links to their websites at the end of the webinar. Now, we don't know how much each of you know about our system. So our goal for this webinar is to make it as accessible and understandable as possible. And if you have questions, please add them in the Q&A box. And at the end, we're going to attempt to answer all of them as well as we can. The chat box is disabled, so all of your questions should go into the Q&A. And just a suggestion for optimal viewing, if you go to view at the top of your Zoom screen and choose side-by-side speaker view, you can see both the speaker and the slides at the same time. And please note that views that might be expressed by the presenters do not necessarily reflect those of Florida Advocates for Behavioral Health and are the views of the presenters only. So now I'm very pleased to introduce our panelists for today's webinar, Suzette Fleischman, who is Vice President of Contracts and Quality Assurance of United Way of Broward County, and she's also the treasurer of our organization. Sylvia Quintana, who is CEO of Broward Behavioral Health Coalition, and Cecile Franklin, who is Regional Policy Director for the Southeast Region, the Office of Economic Self-Sufficiency with the Florida Department of Children and Families. Before we get started, though, Gail, who is also the parent of an adult with a mental health condition and one of our founding board members, is going to launch a quick poll with 2 questions to find out more about all of you. So you can click on any of the choices as to how you identify yourself, and then scroll down so that you can see the second question as well.
And we'll just give you a minute to do that. Answers are coming in quickly.
Yeah, it's interesting. Wow.
One of the best things we can do to improve the system is to collaborate with behavioral health professionals and families and peers. So it's exciting to see that we have everyone on board today.
Okay, so we're up to 74% participation. Did everybody go to the second question below too? Let's see if people are answering it. Yep.
Actually, while we're doing this, Suzette, are you able to forward the link to Sylvia for today's meeting? Because she is supposed to be a panelist, and I believe she's just coming in as an attendee.
I did forward it to her
Thank you
a
so
few
much.
minutes ago. Mhm.
Awesome. Thank you. All right, we have 84% participating. We're getting there. We really appreciate your attendance at our very first webinar for Florida Advocates for Behavioral Health. So thank you. Thank you for being here. All right, 89%. Shall we call it quits and end the poll? We got 116 out of 129. Oh, no, more coming in.
Yeah, I know. It could go 90%. Looks like we have a good. Can other people see the poll results, Gail, or is it
I
just
have
you?
not ended the poll, and I believe I have to end it and then share results.
Okay.
Let's go ahead and end it and see how everyone identifies themselves and where they are in Florida.
Oh, and you can share the results. Okay.
Okay, so 36% are family caregiver of an adult peer with a behavioral health condition. I fall into that category. Peer with lived experience of a behavioral health condition. That was 30%. 41% are behavioral health professionals. 8% family or caregiver for a child or teen with a behavioral health condition. And a behavioral health advocate is 22%, but not a peer or family member. And then where are we from in Florida? 11% from the Northeast, 7% from the Panhandle or Northwest, 15% from Central Florida, 16% from the Southwest region, 46% from the Southeast region, and 12% from Miami-Dade or the Keys. So we're from all over the state, which is truly wonderful. Thank you.
Yeah, that's amazing. Thank you for the poll and thank all of you for answering it. Now we know a little more about who is attending. So I'm a parent and I also helped found a mental health clubhouse in Miami called the Key Clubhouse of South Florida. And through this process, I've gotten to know so many people who have trouble finding the type of behavioral health care that they need for themselves or their families. And we know that delaying help or finding the wrong help can be detrimental to the health and recovery of the person who's experiencing that mental health condition. Our state's behavioral health system is like a huge puzzle with many pieces. And the different pieces are not necessarily connected or organized to make it easy for you to find your way through them. So in the time we have today, we'll be presenting just a general overview of the main parts of what is known as the behavioral health care system. Since it's vastly complicated, we hope to go into more detail in future webinars based on what you are interested in learning about. So although this webinar is designed to help you understand the system, we aren't able to address your personal situations today, but we hope that this will help you decide where to go for help. So, how do individuals and their families know where to begin? First, we're going to take a look at how our state's public behavioral health system is organized. And to do that, I'd like to introduce Suzette Fleischman, who is Vice President of Contracts and Quality Assurance at United Way of Broward County. Formerly, Suzette served as the interim director for the Florida Department of Children and Families, very big role. She has a master's degree in psychology and is a licensed mental health counselor. She is also a member of the board of directors of NAMI Broward County and is the parent of an adult child in recovery. She received an EPIC award for mental health from Mental Health America in Southeast Florida and was recognized as the Recovery Champion of the Year in 2023 by the South Florida Wellness Network. So welcome, Suzette. Can you give us a mile-high view of the behavioral health system in our state?
Good afternoon, Amy, and yes, here today. We appreciate your joining us for this very important webinar. Amy mentioned that our state's public health, behavioral health system is quite complicated. When we say the public system of care, we mean behavioral health services that are funded by the state and federal governments and are available to people who are uninsured or underinsured for the behavioral health needs as opposed to the private, for their behavioral health needs as opposed to the private care available with commercial health insurance or even through self-pay. A few years ago, Amy tried to get a grasp of the public behavioral health system by looking into all the parts and creating a diagram to show how they are funded and interact with each other. And this is what she came up with. As you can see, we are talking about a maze-like decentralized system made up of many moving parts. Unfortunately, for the people who have to navigate through it, it can be extremely difficult and sometimes even daunting. To make things a little easier, we're going to look at another diagram that focuses primarily on the two agencies that we will discuss in today's webinar: the Department of Children and Families Substance Abuse and Mental Health Program Services, known as DCF, and the Agency for Healthcare Administration, known as AHCA. These two agencies operate with funds that come from both the state's general revenues and the federal government. DCF, or the Department of Children and Families, provides services for the uninsured and underinsured, or what is known as the safety net. So a Florida resident who has no insurance or not enough insurance, and an example of that, of an underinsured individual, is if someone's insurance doesn't cover a service like peer support and the person needs that service. Then they can access many types of behavioral health services in their communities by providers that are funded by with DCF funds. These are known as community-based providers. In a moment, you'll learn how these community-based providers are overseen by regional organizations known as the managing entities, who are funded through DCF with the state and federal funds and manage the whole system of care, the publicly funded system of care. The Agency for Healthcare Administration, or AHCA, is in charge of Medicaid, which funds behavioral health services to the people enrolled in those programs. Medicaid is a type of health insurance for people who live with a disability and who meet income level limits, such as individuals living with a serious mental illness. You will soon learn how people can qualify for Medicaid. In Florida, most Medicaid services are provided by private companies through a system called Medicaid Managed Care. And children and youth fall under a different behavioral health system of care. Children ages 5 to 18 from families who meet income level limits can qualify for the publicly subsidized mental health and substance use services through Florida Medicaid or Florida Kid Care. Children and Youth Services are managed by the Department of Children and Families, the Department of Health, and the Agency for Healthcare Administration, depending on the needs of the child or youth. One challenge is that when a person ages out of the system, they enter a completely different adult system of care and need to meet different eligibility standards for publicly funded behavioral health services. Also, to note, it often happens that single individuals end up receiving services from both the Department of Children and Families and through the Medicaid system. One of the problems with our system of care is that providers in these different systems do not necessarily share information with each other, so that a person's behavioral health record may not be accessible by all the behavioral health providers. And the good news is that there are efforts underway to address this issue, which is being worked on by the Data Subcommittee within Florida's Commission on Mental Health and Substance Use Disorder.
Thank you, Suzette. That was a great overview. I understand the system a lot better. Can you tell us where someone would start just to get local resources?
The best place to start is through 211 to access information and referral for local resources and to get connected to our nonprofits. Of course, if someone is experiencing an emergency, we want them to access 911. And if someone is dealing with a crisis and need crisis support services, then we're going to ask that they contact 988 or dial 988. And obviously these numbers can be dialed anywhere in the state of Florida to access services. 988 is a national line. We know that 911 is too, to access the local resources in the community. And 211, we have 211s throughout our nation. These are three very important numbers. Again, 211 for information and referral, 988 if you're experiencing a crisis, and 911 if it's an emergency.
So Suzette, just to clarify a little bit more, what if I'm having thoughts of suicide? What number do I call?
If you're having thoughts of suicide, then I would encourage you to call 988. If you feel that your thoughts are more of a medical emergency, then I would encourage you to dial 911. But the counselors through 988 will determine if you feel that it's not an emergency and you need to just have that counselor at the other end, they will assess and make those determinations as well.
So if it's an immediate life-threatening emergency, I would call 911. But if I'm having anxiety or I'm just really, really lonely or worried about a family member who has a substance use condition, then I would call 988.
Correct.
Thank you so much. And if I call 911, what's going to happen?
They're going to talk to you and get your information to determine where to send emergency responders. They will try to stay on the phone with you until those emergency responders do reach you.
So 911 is going to bring quick dispatch of police or firefighters or medical assistance. Whereas if you call 988, it's more of a counseling situation, and you'll be on the phone with a counselor to talk you through a crisis that you're feeling at the time.
That is correct. And they do have trained counselors. They are trained, trauma trained and informed, and to assist with crisis counseling, de-escalation, and are sensitive to the needs of those that are calling.
Thank you so much. And what if the situation is an opioid overdose? What should you do?
So you want to be able to administer, to call 911 and if someone is not responsive or breathing, but you also, if they are breathing, you want to apply the nasal spray and then call 911. And a place to locate Narcan, you can go to www.isaveflorida.com to identify where near your residence in the state of Florida you can access free Narcan. Where is it being distributed for free? The SAMHSA opioid overdose prevention toolkit, which offers a very quick guide, resource guide, and I know it'll be shown later, is really helpful as well.
Thank you so much.
Okay, thank you, Gail and Suzette. That is incredibly important information that really everybody should have. So this is very helpful. And we also have an idea now of the two big parts of the state level public system of care. And now we're going to take a deeper dive to bring it down to the level of our own communities. And we'll look at what are known as the managing entities and the important role that they play. And we have an expert here on the managing entity system to explain this part of our system. And this is Sylvia Quintana, the CEO of Broward Behavioral Health Coalition, which is the managing entity that oversees behavioral health providers in Broward County. Sylvia is a licensed mental health counselor and certified addictions professional. In her position as CEO of Broward Behavioral Health Coalition, she oversees the development, implementation, and management of the substance abuse and mental health system of care for Broward County state contracts and other local behavioral health funders. She's a board member of the Broward County Homeless Continuum of Care and the National Art Exhibitions of the Mentally Ill, which supports disabled artists. She's also a member of the Florida Behavioral Health Association and past chair of Florida Association of Managing Entities. She's very busy.
Yeah.
She's been an adjunct faculty member at the University of Miami for their School of Continuing Studies department. Recently, she was appointed by Florida's Surgeon General to be a member of the State Child Abuse Death Review Committee. And in the last 6 years, she has received the EPIC Mental Health Award, several ECHO awards from the federal government through federal grants, and was named 211 Broward CEO of the Year. So we're really happy to welcome Sylvia. So Sylvia, can you start out by explaining what managing entities are and how they were created?
Sure. Can you guys hear me? Yes?
Yes.
Perfect. Okay, so the managing entities were created by the Florida legislatures. We're private not-for-profit organizations. MEs were procured by the Department of Children and Families to provide the administration, management, support, and oversight of the state and federally funded behavioral health services. I want to add also that we are like the safety net to the behavioral health system of care. There are 7 managing entities in the state of Florida. You have there a map of where the regions are. And of course, Broward is a little blue square above Miami-Dade County. We're one of the smallest, I would say, areas in the state. However, we have a similar population to Palm Beach, the Palm Beach area, and also a little bit less than Miami-Dade County. So we are very heavily populated. So the 7 managing entities, as you can see, are Northwest Florida Health Networks, Lutheran Services Florida in the Jacksonville area, Central Florida Behavioral Health Network, Central Florida Cares, that's the Orlando area, Southeast Florida Behavioral Health Network, which is the Palm Beach, Treasure Coast, our South Broward Behavioral Health Coalition, and Thriving Mind in Miami-Dade counties and Monroe. So what do we do? So we contract with a behavioral health network of treatment and recovery support providers. We develop innovative programs to meet the needs of our community. We build capacity, provide training and technical assistance to the network providers. We continue to provide the system of care in Florida, a collaboration with local community partners. So that's a lot of what we do. Managing entities network. So the statewide, all of the managing entities have about 300 providers statewide in their networks statewide. We contract for prevention, treatment, and recovery support and crisis services throughout the state of Florida. Services are provided to adult, youth, children, and their families with mental health and or substance abuse disorders. And they can be co-occurring, of course. We use a recovery-oriented system of care approach that utilizes evidence-based practices. And the recovery-oriented system of care, so that you're aware, is really focusing on the recovery needs of the individuals and the family, and we really work with their strengths, and we try to incorporate what they want to do and how they want their treatment to be, so that it becomes from grassroots up, and it includes the professionals as part of that team. Through our network, we provide adult residential services, adult non-residential services, children and youth non-residential services, children's residential services, adult children and family support services, and of course, emergency services. Okay, these are all the services that are funded through the managing entities. And as Suzette mentioned before, some of these services may be funded through the Medicaid or the insurance companies. However, a lot of these services for people that are more chronic and severe are not funded through the basic insurance companies. And therefore, we have those services available to anyone in the community that meets criteria and qualifies. And that's why we're called the safety net, because in reality, whenever an insurance company is not able to provide the services, you can come to us and we're able to place you at the level of care that maybe your insurance company or Medicaid is not funding at this time. So there you have it. I mean, I can mention all of them, but we started from addiction receiving facility, which is like a crisis unit for substance use. We have aftercare, assessment, case management, CAT teams, community action teams, care coordination teams, clubhouses, central receiving centers, drop-in centers, crisis stabilization units and crisis support, day treatment, detoxification. We have the FACT teams for the adults. We have FIT teams for families that are using substance use disorders that are involving the child welfare. We have forensic multidisciplinary teams for clients that are forensic or consumers. We have flexible funds that help fund services that are needed as per the treatment plans of individuals. And these are the flexible funds that sometimes we help to begin to pay for some housing needs or some needs that people have to begin employment or transportation, etc. So we have that capacity. Information and referral. We provide in-home services. We also provide virtual services. We provide online virtual treatment if necessary, inpatient intervention, medical psychiatric services, medication-assisted treatment, mobile response teams, outpatient outreach prevention, recovery and peer support, residential services, short-term residential services, which is a locked facility for people that need extended stays longer than a crisis unit. That's not funded through Medicaid, by the way. Suicide prevention and intervention services, as Suzette mentioned, 988. Supported employment for people that want to begin to work. Supported housing for people that want to live independent. And of course, treatment alternatives to street crimes, which is really targeted for individuals that have become in touch with the criminal justice system. And then we have multidisciplinary teams that really provide treatment approaches to different target groups depending on their needs. So the Florida Assertive Community teams called FACT are really for the adults that are mentally ill with some co-occurring disorders if they need to be, but focusing mentally on the mental health, on the mentally ill people with mental illnesses. The Children's Assertive Community teams, which is CAT, is the same thing for children, focusing on children, but really taking on the needs of the family. We have family intensive teams, FIT, that are really for individuals that are families or adults that are involved in the dependency system using substance use disorders. Family support teams, and these are focusing on, this is like a CAT team with less multidisciplinary intensity. They are really focusing on the family and the child, and they include a family peer specialist, a case manager, and a clinician that oversees the family and the needs of the child and the family. We have a high acuity team for adults, which is like a step down from the FACT team. And we also have care coordination teams that target adults, youth, and families. And these teams are really made up of like a clinical case manager with a peer specialist that really helps individuals move from higher levels of care to lower levels of care, helps them connect to the appropriate services that they need, and then helps them connect to natural support so that they can continue their recovery process. And these are the managing entity specialty teams throughout the state of Florida. And I can't read the details, so you guys would have to get the slide.
Yeah, we showed this so that you can go to the Florida Department of Children and Families site, and we'll provide you with this direct link when we get to the resource guide at the end of the webinar. But you can go to that link and see where the FACT teams are and have the contact information for them, and the CAT teams and the FIT teams and the forensic multidisciplinary teams and the mobile response teams. So that's why we included that.
Perfect. No, it's great. It's great access, and you have the information there. So if people can have access to that slide, that would be awesome.
Yes.
Okay. And then we all the managing entities really subscribe to evidence-based practices. We want our case managers, our peer specialists, our clinicians to really have the best training possible to deliver good evidence-based practice to their treatment. So this is a sample of some of the evidence-based practices that are provided throughout the managing entities in the state of Florida, and it's done through our providers, right? Our provider network. So motivational interviewing, wellness recovery action planning, mental health first aid, trauma-focused cognitive behavioral therapy, trauma incident reduction, infant mental health, wraparound services, or wraparound, which is a special evidence-based practice that includes case management. Transition to independent process, we use a lot for adolescents, works very well with the 14 to 29 years old. It's really works as we train people to become life coaches and work with the adolescent population, which they really love and they engage. Crisis intervention teams as a practice for the care coordination teams. Supported housing, individual placement support, which is a supported employment approach to employment for people with mental illness and substance use disorders. International model clubhouses, the TMAC for FACT teams, which is the special best practice for the FACT teams. Clinical time intervention for the care coordination teams, and LOCUS and CalLOCUS levels of care assessment, and of course the ASAM. So this is an example of what we offer for best practices throughout the networks.
Sylvia, can you tell us what LOCUS and CalLOCUS and ASAM stand for?
Oh, okay. So the LOCUS is a level of care assessment for adults. The CalLOCUS is for children. It's a children's a level of care assessment. So it really, when people come to these meetings, they pretty much they come to be assessed and they need higher levels of care. We do this level of care assessment that tell us, hey, don't start with outpatient. This person really needs like a multidisciplinary team. Or no, multidisciplinary team is not sufficient for this person because their complexity and their illness requires really like a residential level of care. And it could be a residential level 1, or it could be a secure facility or an emergency, a crisis unit. So the level of care assessment really tells us what level of care they need so that people don't waste their time really going to levels of care that are not appropriate for them. By the same token, we don't want to put everybody in a lock facility, and we don't want to put everybody in an emergency facility. We really want them to be at the right level that they need. And that level of care assessment helps us to place people in the right level of care. And then when they're discharged, you may be in a residential setting, but you really have progressed a lot. and you don't really need to go to a multidisciplinary team. Maybe you can go to a care coordination team that will connect you to the services you need in the community and support you for as long as you need, and then you're on your own with your natural supports. So that's what that is. And ASAM is the same thing, but for substance abuse. It does assess co-occurring disorders, but it's the whole the substance abuse level of care assessment.
Well, that's incredibly important. Thank you very much.
Sure. Okay, and then care coordination is a phenomenon that took place about a few years ago. The state and we all agreed that it was very important to provide care coordination to connect people to treatment and engage them. So it is an organized activity to coordinate individuals and holistic care, assist individuals who are not yet fully connected and engaged with services, and supports their wants and their needs. Collaboration, it provides collaboration across systems and providers to assist with successful transition from higher levels of care to community-based care. The implementation of the evidence-based practice critical time intervention. And care coordination really, we have found that to work well needs to happen at the funder or payer level, but also at the provider level. Many times our providers are trained on care coordination, the CTI, they do a great job with it could be individually or with a peer and a clinical case manager, but then our systems, like Suzette mentioned before, don't collaborate with each other. At a higher level, you get a lot of barriers. And although the person needs to maybe be connected to, the homeless continuum of care or Medicaid plan to pay for certain things, and maybe the managing entity for pay for others and so forth, certain levels create barriers for the clinical case managers and the peer to really connect people to services. So here comes the funder level care coordination. So at the managing entity, we have some care coordinators that work really to eliminate barriers from systems. So it's like a system care coordination. So we can make a phone call to somebody at a hospital and say, I need you to hold this person for another day because they're going to have a bed available tomorrow. And if you hold them for one day, they'll have a smooth transition into a system. Case manager is not going to call the hospital administrator to do that. Yet in our system, we can call those levels of systems to really help coordinate better care and transitioning smoother from a higher level of care to lower levels of care. Or for example, for Medicaid, call a managed care plan to say, we need you to pay this intensity of care because look what we have and what we've done with this person, and you need to provide this and we'll provide this other stuff, right? For example, we coordinate, in the FACT team, we coordinate housing for the FACT team members, right? So it may be that the Medicaid is paying for the plan's participation in the FACT team, but Medicaid doesn't pay for housing. And so the housing part of the need for that person is coming out of the managing entity. We have to work together to ensure that both are authorizing the needs for that client. And in other cases, it may be a health plan that we need to make sure that they have access to certain types of specialty because we've tried everything else and now we need something special that they need to provide. So that's what we do at a funder payer level, and we collaborate with the provider at their level.
That's incredibly important. Thank you so much for all of that coordination.
Thank you. Okay, we also have peer organizations. Our wellness community organizations, their leaders and their members have a singular goal, and that's to enhance the quality and the quantity and quality of support that is available to people seeking and experiencing long-term recovery from mental health and or addiction. All managing entities contract with recovery community organizations, which are called RCOs, and these organizations in turn have peer specialists that are there to support the recovery of individuals, whether from mental health or from substance use disorders. And I can tell you that it's very important that recovery is supported because we can do all the treatment in the world, but if people do not have supports through their recovery lifespan, they'll come back and relapse again, and then we're back to square one. So I think recovery and supportive recovery is as essential as treatment.
Yeah,
and then we have a best practice called SOAR, which is called Outreach, Access, and Recovery with Social Security. It's a national program designated to increase the access to Social Security Administration disability benefits for individuals who are experiencing or at risk of homelessness and have a mental illness, medical impairment, and or co-occurring substance use disorders. The managing entities serve as the local SOAR leads for their regions. You can contact your managing entity to find who's a SOAR trained caseworker, and they can do the application to the SOAR benefits for free. It used to be that within a 90-day period, we were able to get people eligible for services and with their Social Security and their Medicaid together, which helped us a lot in getting them access to treatment. It's taken a little longer now because of a lot of the federal cuts that have taken place since COVID and so forth. But it is the fastest approach to getting individuals engaged in accessing Social Security Administration's disability benefits and also their Medicaid.
Thank you so much for that extensive information. And if there's any family members out there like me who have loved ones with serious mental illnesses, or substance use disorders, please get to know your managing entity. When I met Sylvia Quintana more than a decade ago, I began to understand so much more about our behavioral health network. And I've worked over the years with folks from our managing entity, and they really care and do a great job. So I encourage you to collaborate with them if you're a family member or a peer. Now, Sylvia, I have some questions for you.
Sure.
Do the managing entities have websites?
Yes, they do. All the managing entities have websites.
Okay. What if I'm a person with commercial insurance? Can I still call the managing entity to get information?
Sure. And like I said, some of the commercial insurances do not pay for all the services that maybe the individual needs or the child needs. And you can coordinate with a managing entity the care of what the insurance can pay and what else do you need for us to support during your services.
That's awesome. And how do the managing entities stay in touch with the residents in their area to know that they're meeting their behavioral health needs?
So, so we in Broward have a meeting called the ROSC, Recovery Oriented System of Care meeting. We invite all of the stakeholders to the meeting, including providers. And so we discuss a lot the needs and what they see on the ground. We also have a consumer advisory council where all the consumers meet bi-monthly, every other month, to talk about issues that they find in the system, because nothing is perfect. And so as that is brought up to the board, one of our board members is the one that leads that group, which is a person with lived experience. And every time she finds things that are coming to her that are not functioning well, we learn about it and then we investigate and find out how to address the issues and concerns. So all of the managing entities have a similar process in place, either by meeting with consumers, providers, or stakeholders in general, because sometimes stakeholders are the ones that come over and say, hey, we got a problem. For example, how many people do we have that are mentally ill in the jail? They are not getting out fast enough, which is a big issue in Broward County.
Yes,
and so we all work together in trying to find out how do we solve expediting the process for discharge planning and appropriate services in the community.
And I believe you have a needs assessment process as well. Can you tell us about that?
Sure. So this is part of the process. Every 3 years, we do a triennial needs assessment. In fact, we're in the process right now of completing our triennial needs assessment. And pretty much it goes back into the community. We have surveys that go out. We have focus groups with the different groups and stakeholders to hear from you all what the needs are and what we need to request, because that triennial needs assessment is put into a document that then is submitted to the state of Florida. And DCF then looks at the document and says, these are the needs that we have. They go to the legislature and apply for funding or additional funding to be able to support our needs. Not always everything gets answered, but at least the information's there in case the legislature says, well, why do you need this? And then you have all the managing entities sending their triennial needs assessment. And then annually thereafter, we create what we call an enhancement plan, which is a additional document that provides an updated version of what is the need in the community. So annually, we're submitting to DCF a enhancement plan that says these are the needs for this year, which usually coincide with whatever is in that triennial needs assessment, but then it gives you a little bit more information on the year to date needs for the area that the managing entity covers.
So there's a lot of connection with the community in order to establish these needs and report them to the folks who can provide some funding.
Right.
So do managing entities help people with serious mental illness find housing?
Well, so we're not a housing provider.
Right.
However, because we do believe in supporting the treatment plan that folks have, many times housing is a key to be able to sustain mental health recovery or substance use recovery. So for example, someone goes to a residential treatment program and they're getting ready to be discharged and they need housing, they don't have a place to go. We may be able to help them, support them temporarily. We call them transitional housing, with funds to support them transitionally into a less restricted level of care, so that people can provide services while they live in some kind of housing, and we can help with some of that rent temporarily until either they can get employment, they can get their Social Security disability check, or whatever they are connected to. You know, I'm part of the homeless continuum of care. We're always looking to see how the county can help focus on the people that are homeless with with disabilities, right? With behavioral health disabilities. It's tricky because HUD doesn't exactly, they only focus on the homeless people, and they have restrictions that do not really help our folks. I think we need a special type of funding for people with behavioral health disorders. We can't have someone wait in the streets for a year to be able to qualify for permanent supported housing.
Exactly.
If we treat somebody, we need them to get out of treatment and go right into housing and continue with their recovery supports and treatments. And something needs to be done to really help connect the housing programs from the federal government with the whole behavioral health approach to treatment.
I completely agree. I have one last quick question. So we know that the children's system of care is different from the adult system of care. So do managing entities help with that transition when a child is moving toward age 18 and would go into the adult system?
So my understanding is that if someone is, say, age 17 and they're in a residential treatment program and they turn 18 before they complete their residential treatment program, we usually continue to pay for them, although they may have to put them in an adult bed in a program. We'll continue to pay for them out of this children's pot of money until they complete that program. The provider that is with that person usually is the one that does the application and the transition from their Medicaid, their disability application, the SOAR, etc., to qualify them under the adult system. So it's really through our providers that we are able to help individuals that may be disabled when they are 17 years of age and now are transitioning to the 18 years of age, and now need to be engaged in the adult system's disability, because the regulations are different, their qualifications are different. And there again, here we are, the safety net. We continue to help them and support them while they get that disability on board. And then, some people, children, when they grow and they become adults, although they may have some disabilities, their therapists may have helped them enough where we can mainstream them, in quotes, with support into colleges or vocational programs where they will continue with their lives, right? And they may need some housing. Same thing, we help them get going. We developed through one of our grants a permanent supported housing program for young adults, and it was very successful with one of our providers. And they have done really well, and they were really engaged in keeping their housing and keeping their mental health straight. So they really were engaged into treatment. So there's a lot of supportive safety net stuff that the managing entity does to help with those kids transitioning out.
Thank you so much. Amy?
Wow. Okay.
Wow.
So that really gives you an idea of how important the managing entities are in this whole system, because they're local and they basically are a hub of all these different types of services. So, Sylvia, thank you for that really excellent overview. And I see that there's a lot of really great questions in the Q&A. And I saw also some people raising their hands. I just wanted to remind everybody that we are going to answer questions at the very end of the webinar. So just hang in there because I saw some really good questions that people have. So now we are going to wade into the topic of Medicaid. So as we saw, Florida's Agency for Healthcare Administration, that we call AHCA, oversees the Medicaid program and the companies that operate it. There are more than 4 million Floridians receiving healthcare through Medicaid. So when people experience the onset of a serious mental health condition like schizophrenia, bipolar disorder, or major depression, they may no longer be able to go to school or work. In fact, that's probably more common than not. And if they're adults, they can lose access to their traditional health insurance, either because they can't afford it or they're not working for an employer anymore who offers health care. So they absolutely need some form of health insurance for the treatment of their condition. In Florida, people with serious behavioral health conditions without access to other health insurance can often receive their health care services through Medicaid. And in fact, Medicaid is the largest single payer for behavioral health services in the entire country. So how does a person with a behavioral health condition become eligible for Medicaid? Our next speaker, Cecile Franklin, is going to explain that process. Cecile is another expert. She's the Regional Policy Manager for the Office of Economic Self-Sufficiency in the Southeast region for the Department of Children and Families. She is a certified Lean Six Sigma Silver Belt, which I looked up, and it means that she is a super manager. She's a certified practitioner of the Myers-Briggs Type Indicator, a Sterling examiner, and a certified professional trainer. She received the Heart Forward Leadership Award from the Department of Children and Families for exemplifying compassion and empathy in leadership. And Cecile works closely with local community partners to ensure the seamless delivery of services to those receiving or applying for public assistance. So Cecile, can you tell us how people living with serious behavioral health conditions can qualify for Medicaid?
Yes, I can. Thank you so much, Amy and Gail. It's my pleasure to be here, and good afternoon, everyone. So there are really two avenues for a person with, serious behavioral health conditions or any other medical condition for that matter to apply for Medicaid. Number one, the individual can apply for supplemental security income, also called SSI or Social Security Disability, through the Social Security Administration. If approved, someone who receives SSI will automatically receive Medicaid, and someone who receives Social Security Disability will be entitled to Medicare. In addition, these individuals will also receive a monthly stipend. This year, the maximum for SSI is $967 monthly. The Social Security Disability, of course, will vary depending on the amount the individual earned and paid into the Social Security system. The applications for disability with this agency, with Social Security, does require extensive documentation. So it could take several months for that, to be processed and for eligibility to be determined. The second avenue is then to apply for Medicaid directly through the Department of Children and Families. So that's a state determination. Through Social Security, that's a federal determination. If that's confirmed through our disability process, through a division of disability determination, that person may be entitled to Medicaid, but that does not come with a cash stipend, as does the SSI or the Social Security determination. An individual can apply for both at the same time too, to ensure, a quicker response, if you will. But if the state makes a determination and then the federal makes a determination that differs, the state must opt or adopt the federal determination of disability. And again, as I mentioned, both of these processes can take several months. All right, so let's talk about who is eligible for Medicaid in Florida. So for the Department of Children and Family, the state agency, adults are eligible if they have related minor children up to age 18 living with them in the home. And pregnant women will, of course, meet that definition as well. Adults who are disabled, adults who are 65 years or older, and children up to the age of 21. In all instances, there's an income level and other technical requirements that must be met. So it's important to note here that if an adult is not disabled, 65 or older, or does not live with related minor children in the state of Florida, that individual would not be eligible for Medicaid through DCF.
Thanks so much, Cece. So if a person is applying through the Department of Children and Families, who determines if the person has a disability and what constitutes a disability?
All right, so through the state of Florida, the information is collected and submitted to the Department of Health. That's where that Division of Disability Determination is housed. So, and what constitutes is that the individual must have a condition that would prevent them working or expect to work for at least 12 months or may result in death. And so again, that's medical documentation that must be gathered and presented in order for that determination to be made.
And we understand that most Medicaid services in Florida are provided by the private companies through what's called Medicaid managed care. Does everyone have to be on Medicaid managed care, or can you receive straight Medicaid?
Well, that's an important question. So ACA, as you mentioned, oversees or administers the Medicaid program, and that is the agency that determines who is in Medicaid, in managed care, I'm sorry. Now, the majority of eligible individuals are in managed care. Again, ACA decides that. It's important to know, though, that these plans, provide a more extensive coverage, and, they have many more healthcare plans, that are beneficial to our to recipients of Medicaid. Initially, individuals are assigned to a plan, but they have 45 days to then choose a plan. And then they're locked in after, I believe 120 days for 12 months. So it's important that when you receive that information regarding your plan and choices, that you contact them, ACA, as soon as possible to choose your plan.
I believe it was around 2013 or 2014 that pretty much everybody had to choose a Medicaid managed care plan. Because I remember when my son first got Medicaid, it was just that lovely gold Medicaid card, and now he chooses a plan every year. So if you've just been diagnosed with a serious mental illness like schizophrenia, when should you apply for Social Security income or Social Security disability income, which would provide you Medicaid or Medicare?
Well, you should apply as soon as possible. And, you mentioned serious, but again, we are not the ones determining that. So again, as soon as possible. And it's important to note that in some instances, and I mentioned those instances, parents with minor children or children up to 21, they may not need to be disabled, or that may not have surfaced yet, right? That illness. So you could still go ahead and apply. And if you're eligible, you'll have that from then, and when you need it.
And what if you're denied?
Well, if you're denied for both agencies, the state agency or the federal agency, Social Security, you will receive denial notices with instructions for the appeals process. So you're able to use that, to challenge that and to present any other information that you may have.
And what does a Florida Medicaid managed care plan cover? Just in general.
Well, in general, it covers dental and regular Medicaid and some behavioral services as well, behavioral health services.
And lastly, can you explain how someone would apply for Medicaid through the Florida Department of Children and Families?
Certainly, I believe, here we go. So you can apply through our website, and it's easy to remember. If you just remember myflorida.com, and it's very easy to navigate, there are little links. Click on here to apply, or you can go to one of our local family resource centers. The links is there. And all that information, again, you can find on our myflorida.com website. And the third option is to go to one of our Access community partner sites. And those are agencies that are committed to assisting Floridians with applying for Medicaid. And they also help navigate you through the process of the application. And you can search by your zip code, county, or city to be able to find one that's closest to you.
Thank you.
You're welcome.
Yes, thank you, Cece. That was really excellent information. And now we know about the two ways that a person can apply for Medicaid if they have no other form of health insurance to receive treatment for serious behavioral health conditions. At this point, we would like to share some resources that could be life-saving. We've created a 2-page, what we're calling a quick guide to behavioral health resources that focuses on what's available in Florida. And we're just showing some slides of these pages right now to show you what's on the guide. And Gail, would you like to talk about it a little bit?
I would love to talk about 988. I'm going to go through these rather quickly because we do want to have time for your questions, and I see that it's already after 1 o'clock. So I'll just tell you that 988 was activated across the nation by July 16th of 2022. In Florida, we have 13 988 call centers. Most of these are also 211s, so they can access that 211 database. And as of March of this year, our 988 Florida Lifelines answered 321,960 calls and provided over 125,000 referrals to non-acute behavioral health services. So we're getting to the appropriate level of care. 10,500 referrals to the mobile response team, and handled 3,235 calls involving an active suicide attempt, with each individual successfully reaching the next level of care alive. So that is really something to be celebrated. Our call centers are truly champions. And so I'll just tell you a little bit about our particular 988 Florida Lifeline. We don't want you to wait until it's a crisis. So the Department of Children and Families has decided to call it the 988 Florida Lifeline. So you call if you're feeling anxiety, or if you're feeling lonely, or if you're worried about your loved one with a substance use disorder. You don't wait until it is a crisis. So remember that. And there are backup centers if they don't pick up right away. Now, when you call, you do get your local center that can refer you to local resources. But when you text, right now, we don't have that geo routing in Florida to route you to your local call center. So you might be texting with a 988 center that has a texting contract that's in Iowa. The same thing is true if you use the chat feature. You can go to chat.988lifeline.org to chat. But again, you won't be connected to your local Florida call center. This will, it will change over the next 1 to 2 years. We do expect that the texting and maybe the chatting too will be local. So you'll be connected locally to those great resources. So the 988 Lifeline has some other lines. They have a veterans line, a GLBTQ line, a special Spanish line. They can translate into many, many different languages. So don't be afraid to call. They're really nice. They're really friendly, and there's someone to call. Mobile response is someone to respond. Someplace safe to go would be like our centralized receiving facilities that can assess someone, and you can stay there for up to 23 hours to be stabilized, and they'll link you to services. I'm going to skip mobile response teams since we covered them briefly, but on this guide that's posted on our website, you can click on that link where it says mobile response teams in Florida, and it'll show you where they all are. It's that Department of Children and Families slide and the contact information for them as well. And you can call them directly. Let's go to medication overdose. Unfortunately, this was needed in my family, the poison control hotline. Fairly recently, a loved one took two separate doses, Monday's meds and Tuesday's meds also. And I had to call poison control, and they were wonderful. So that's good to know. And we've talked about 911. If you do have to call 911 and it relates to behavioral health, be sure to ask for a CIT trained officer. That's a crisis intervention trained officer who understands behavioral health disorders and has received 40 hours of training in that area. We've talked about 211. We've talked about getting to know your managing entities, and Sylvia covered all the specialty team services. Connecting with a peer recovery organization is wonderful. Sylvia talked about the peers. NAMI. NAMIs are wonderful. They're all over the United States. The National Alliance on Mental Illness. We have one in NAMI Broward that really helped our family quite a bit. It was a few years before we found them. And, you know, when mental illness first affects a family, it's great to get help right away. You don't want to wait until you're in crisis and you don't know what to do. So connect with NAMI in your community as soon as you can. Get to know your managing entity. Mental Health America is also a wonderful national organization. We have a great one in Broward County, Mental Health America of Southeast Florida, and they offer many direct services to the community, and clubhouses for people with serious mental illness. And I'm going to let Amy talk about those because she's the president of the Key Clubhouse of South Florida.
Yeah, just briefly, there are 20 clubhouses in the state of Florida, and there is a link on our guide so you can find out where they are. But they're very special. They offer free services. People actually go into clubhouses to work and recover through meaningful work. They basically run the clubhouse with the staff members, and clubhouses also offer employment placement in the community, which is really important part of recovery. And it's a wonderful model. So you might want to look into it. It's an international model. There's clubhouses all over the world.
We would be remiss if we did not point out first episode psychosis programs that are so effective helping people after a psychotic break to get help, to have their family involved in the treatment and to get back to work or back to school. We have one of these first episode psychosis programs in every managing entity region of the state. You need to know about them though, because they only work for a certain time period. I believe it's something like 1 to 2 years after that first episode of psychosis. So we do have a link that will show you where they are throughout the state. And lastly, the Find a Psychiatrist, Psychologist, or other behavioral health professional link, it takes you to Psychology Today, the magazine, and you can search by zip code or specialty to find a behavioral health professional that can help you in your area. And there's the QR code if you would like to use your camera and go directly to all these resources, then you can actually click on all the links or you can download the resources.
And Gail, I wanted to also, I didn't see isaveflorida.com on there, but want to make sure that we have it on there. And again, if anyone does experience a loved one or a friend with an overdose, call 911 first and then apply naloxone.
Thank you. Thank you so much, Suzette.
So it's time for questions.
Yay.
Okay. Gail, do you want to read them or do you want me to read some of these?
Oh, I would love for you to go for it.
Okay. Some of them I sort of answered online, but somebody, let's see. Do you know who we would contact for those services funded by the managing entities? You would call your local managing entity, and on our guide, there's a link to all the managing entities and their phone numbers. So you could find whoever your local managing entity is through the guide. Somebody's asking about supportive housing. How is that accomplished in this housing crisis season, as evidenced in South Florida? That's a great question. Gail,
Well,
do you
I'll
want to
take a
try that
minute
one?
I'll just take a minute to plug the Florida Supportive Housing Coalition, FSHC. Go to their website. They are always advocating and lobbying for more supportive housing for anyone who needs it, including people with serious mental illness and other types of disabilities, and elderly housing and so on. So they are doing a lot. I am still waiting to hear exactly how much money is going to go toward affordable and supportive housing this year in the state budget. So we'll see what happens with that. And I know that's not a great answer. I will say that at BBHC, Broward Behavioral Health Coalition, there's a really wonderful housing specialist there who I call upon quite often, William King, who works with Sylvia. And I believe all the managing entities do have housing specialists.
But there is a great shortage, and that's one of our primary advocacy issues is more supportive housing. So this is something that we're very aware of and are all trying to get more of. What services can be provided for a parent of a teen that doesn't meet income guidelines for Medicaid, have exceeded insurance thresholds, and just can't afford care? Maybe Sylvia can answer that.
So I would suggest that if they have exhausted all their insurance coverage, the person gets in touch with a managing entity to see what kinds of services they need, because we do pay for services when Medicaid, they exhaust their Medicaid benefits or their insurance benefits. We can work in trying to help with that. It may be through our provider network, but we can look into it.
Okay. Is it possible to get a copy of these slides? This is such great information. Yes, we are going to post the slides on our website after the webinar, so you can find them very easily. And our website is floridaadvocates.org. Somebody asked Sylvia, do the services have waiting lists?
So our residential programs do have waiting lists because we do have a lot of referrals going into residential. The outpatient programs, some do, some don't. We have a lot of providers in the network that offer services. So it depends on what kind of service do you need? Do you need an appointment for an assessment? It really depends on what the need is and for whom.
Okay. Another person is asking, we run across issues when the individual who clearly needs help refuses to be assessed for the need level of care. Mm-hmm. Sometimes they are in the hospital and want to be discharged, not moved to a different level of care. They end up being discharged and their needs are not met. Do you have any suggestions?
Yes, so I want to share with you, and this is for the peer specialists and the people that are family peer specialists. It could even be NAMI folks, that number one, we have peer specialists that are youth peer specialists that are trained and they work for the recovery-oriented communities, RCOs, and they can be sent in to engage the individual in treatment. And we've been very successful at that. We've had very difficult high utilizers in the adult system that have been very successfully engaged with our peer specialists and clinical case managers, and slowly engage into connecting them to services and followed up and supported. So I really think that when people do not realize their illness and they don't want treatment because they're tired of treatment, if you are able to engage them with peer specialists, recovery peer specialists, especially if they are like them. For example, if there's a family member, a family peer specialist, if it's a youth peer specialist, if an adult peer specialist, usually they speak the same language, they have the same similar experiences, and from their lived experience, they're able to engage and really engage the person into improving their lives, because people are tired of being hospitalized, in and out of hospitals. So a peer could really be helpful in this case.
I want
very
to add
true.
one thing. A judge can order outpatient treatment, inpatient or outpatient, or a combination of those. And according to the most recent Baker Act law, the discharge planner at the hospital has to set up a follow-up treatment plan. So someone can go from a Baker Act facility into outpatient treatment,
Right.
hopefully with the family involved or with a peer specialist involved, someone to keep them engaged in the treatment.
Right. And that's true, Gail. This past year, they passed legislature with funding to be able to commit, or not commit, it's mandate, I would say, people into involuntary outpatient placement.
Yep.
That's what it's called.
Yeah, that's good news for family members who really want to get help for their loved ones.
Yeah.
Can inmates who have been sentenced rather than treated be assessed before they are released so that there is a smooth transition into mental health care? It's a good question.
So I wanna share that depending on where you live, you may have a mental health court. We do in Broward, or you may have judges that basically take mental health. In many cases, judges order assessments and have someone present to them a treatment plan, which becomes like their mental health probation, depending on what kind of whether it was a felony court or a misdemeanor court, depending on how they're engaged in the criminal justice system. But many courts now are aware of the fact that individuals in jail are mentally ill. I mean, Broward has a lot of people with mental illness in the jail, and they do want to discharge them to treatment services so that they don't reoffend as a result of their illness and are not being treated. So I would suggest that you contact the managing entity in your area. They may be able to help you better with what is available in your area.
Right.
Yeah, and the Tristan Murphy bill passed. Tristan Murphy sadly took his life. He had a serious mental illness and he was in a prison, and his mother advocated and did an amazing job and got a bill passed this last session that helps to set up diversion programs. There are grants available for communities to set up diversion programs. And we're going to be talking about that at the NAMI Florida conference in September with Judge Porth from Broward County and Melinda Blostein, public defender from Broward County, and a state attorney from Duval County. So we're going to encourage you to advocate for these diversion programs in your areas.
Okay. If Florida had Medicaid expansion, would these services be more accessible to those in need? I understand that in states with Medicaid expansion, the services are more accessible to those in need. And I would say yes. Florida had Medicaid expansion, more adults who have not qualified for Social Security, SSI or SSDI, or other disability, they would have access to behavioral health services through Medicaid. So it fills a gap that we have right now where we have, I don't know how many, it's a huge number of people who don't have any health insurance at all. And Medicaid expansion would help cover their healthcare needs based on their income level. Is there a waiting list to become part of the FACT team in Northeast Florida? Can the FACT team be mandated? I think that's a Sylvia question again.
I think that I don't know if a judge can order someone to go into the fact team. Usually judges are allowed to order people to be assessed to determine the right level of care based on court determinations. They're usually not allowed to order people into a facility per se, unless there's a clinical recommendation saying this is what you need to do. Fact teams sometimes do have a waiting list. I would suggest that you contact your local managing entity to determine whether there is because for example, Broward only has one fact team, but Northeast Florida has like 2 or 3 fact teams. So I would suggest that you contact your managing entity in the Northeast and find out, or the Southeast, and find out whether they have a waiting list and how to engage in applying for facting services for a loved one.
Okay. How are all the big bad bill cuts going to affect these services? And that's a great question that we are probably going to be studying in the next month or so. So there's some analyses going on right now.
Yep,
We probably
Florida-
have to wait until we find out what exactly gets passed and signed. But yeah, that's going to be an important issue for Florida as well as every other state.
It's really critical, and NAMI and many other behavioral health organizations have asked us to contact our United States senators and representatives. The bill's in the Senate right now, the U.S. Senate, and we need to contact them over and over again and talk about how this will affect people with behavioral health conditions and lots of other people as well. You can go to NAMI.org, and you will find their advocacy campaign, and you can then follow through to contact your United States legislators.
How do you determine which is the managing entity for your county? Well, this is in Palm Beach. So that's Central
Southeast
Florida
Behavioral Health
Southeast
Network.
Florida Behavioral Health Network. Yeah, Southeast
Yeah.
Florida.
Yeah, and that's in the resource guide. You'll get
Yeah.
a link for all of the managing entities and their contact information.
Can someone be Baker acted to an SRT, which is a
Short-term residential
short-term
treatment.
residential treatment? I've been
No.
told that it is voluntary and the individual must be assessed for that level of need. They refuse the assessment and do not have access to the SRT.
No, that's not how it works. So the SRT is an extended acute care facility. So technically, someone can be Baker acted into a crisis unit, right? A crisis level of care. And then once the determination's made that they cannot be stabilized and they need a longer stay, they can be then transferred into an SRT involuntarily. They can also go in there voluntarily, like the Baker Act, right? You can determine that, hey, I'm not well, I really need to be checked out, and you can voluntarily yourself admit yourself to a crisis unit to be checked out and retune, assess for medications. So the same thing happens with an SRT. This SRT could accept people involuntarily from a crisis unit, under a Baker Act, or they can go in there voluntarily.
Okay. This person asked, I haven't heard Medicare mentioned. And then she also asked how our Medicaid service is going to continue when the current bill in the Senate stops putting money into Medicaid. And why has Florida never expanded the options they had with Medicaid? Try to answer those. Cecilia,
I have no idea why Florida hasn't expanded. I do know, what I can recall when we expanded Medicaid, with the state with Affordable Care Act, Florida at that time opted not to expand, which is why those single adults who aren't disabled and don't have minor kids, that is why they can't be covered by the state. But I don't know why. I'm sorry, I can't answer that question. And I don't know. We haven't heard any information yet regarding how the budget cuts are going to affect our program.
Right.
So, I can't speak on that until we're, made aware.
Right. The big beautiful
sorry
bill
about that.
it's not passed yet. The the Medicaid cuts, which would be severe, would happen over a decade. But it would still be very severe.
It would.
Can an adult with joint custody also be eligible for Medicaid?
Okay, so I can answer that.
Mhm.
So often if there's a court order or binding separation notice or, a custody agreement or something, that might establish where the child physically resides. So we would look at that, and that document normally this determines who claims the child as a tax dependent. So we look at that. If there's no such document, then we typically will look at who is the primary caregiver of the child, which is where does the child spend most of their nights. So generally that's how it's done.
Amy, we have time for one more question,
Oh boy, there's so many here. Okay.
but you can email us.
Yeah. Okay, one more. Do you know if an adult person who is mentally ill can qualify for SSI or probably DI, to get Medicaid, Medicare with years of work through their parent if that mentally ill person never worked?
Well, we can try and answer that. That is Social Security. However, if the adult is just applying and never worked and has no quarters, as an adult, and was never determined disabled as a child, there is potentially no Social Security. But they could be eligible for SSI, Supplemental Security Income, which is if they've been determined disabled and the income and assets are within the SSI guidelines, then that person could be potentially eligible for SSI. And that's something, right? You can, check with Social Security on that.
Okay, so I guess, Gail, if there's still more questions. If we're not able to answer them, can we contact the person through their email? I mean,
We have our emails up, I believe, right here.
okay.
So
Okay.
you can email me, geezygale@gmail.com, or you can email Amy at amyjmcclellan@gmail.com,
Okay.
and we will do our best to get you the answers.
So
Go ahead and wrap it up, Amy.
I am going to wrap it up because we wanted to end at 1:30 for everybody. So first of all, thank you for attending the webinar. And we have a survey. So when you end the webinar, there's going to be a survey. And we really need your responses to the survey so we can figure out what webinar we should do next and what topics you're interested in. And once again, we're very indebted to our sponsors, North Star Financial Planners, Cornerstone Solutions, and Newport Healthcare for making this webinar possible. So as Gail said, you can contact us with your questions. And if you'd like to help Florida Advocates for Behavioral Health grow, please consider making a tax-deductible donation at floridaadvocates.org. We accept donations of any amount. All of us are volunteers. So your donations are going to be put to work to support future webinars and advocacy materials for everybody. So thank you again, and please remember to complete the survey that pops up after you exit the webinar.
Thank
Thanks,
you so
everybody.
much, everybody. Have a great day.
Thank you. Bye.
Thank you. Bye,
Bye-bye.
everyone.